Hi, I'm Wanda Miller. I'm the Director for Nursing and Patient Care Services at Riverside Tappahannock Hospital. I've been a practicing nurse for a little over 40 years. I worked in a community setting. I then went to an academic setting, and in that setting, certainly supported research. There were always clinical trials and device trials. We actually did qualitative studies in nursing in all of my departments, being cardiology and emergency medicine. About 4 years ago, I chose to go back to the community setting, and for the first time really had an opportunity to do hands-on research with Dr. Newhouse and her incredible team from University of Maryland. Working in a smaller facility in rural Virginia, it's been very exciting. I think the patients have been very excited to be a part of a study. I think they were a bit surprised to have that opportunity in a small community facility, but they've been very inquisitive, they've been very engaged, and very willing to participate. I think certainly from an educational perspective, and I'm an adjunct faculty member, that's taught from day one of nursing school. I think it becomes a bit more difficult in a smaller facility unless you have leadership and accessibility. So leaders who support that kind of practice and also accessibility to the literature. The advice I would have, particularly in the rural setting, would be to expect our patients to be excited. You can expect that. You can expect them to be engaged. You can expect them to be inquisitive. I would advise you that you will be working with some of the finest clinicians. So having had the benefit of being in an academic center as well as a rural hospital setting, our clinicians choose to be in that rural setting, and they choose to be a part of that community and to make patient care better for those patients there. So expect to find some of the finest clinicians. I would tell you that the term jack of all trades is just part of our job description. So these folks have to be extraordinarily innovative. Sometimes they have to be tenacious to get what they need for their patients. I would tell you that you won't see all services offered in a rural setting, but what we do very well. And we then will make every effort to make sure that our patients have access to the services we don't offer in a timely manner. For example, we have pretty sophisticated protocols, and our colleagues in Richmond tell me that I can get my patients into their cath lab a lot quicker than they can get them to the cath lab from across town. Don't be surprised by the technology that we might have. So even though we may not offer everything, we'll offer the best. So you might see a state-of-the-art CT scanner and an MRI, and you may not see a cath lab. You can expect the staff to be engaged and excited to be a part of it, and looking forward to that opportunity to be engaged in something bigger than what they do every day.